My name is Scott Blumenthal, and I'm an orthopedic spine surgeon at the Center for Disc Replacement at Texas Back Institute in Plano, Texas. The history of my particular interest in arthroplasty, artificial disc surgery, really dates back to my beginnings in practice 2.5 decades ago when we were doing fusions for back and neck issues. And what the patients would say is, "Doctor, how come you can't replace my disc because you can replace knees and hips and things like that?" After maybe a decade of what I would consider first generation artificial discs, the Mobi-C came about, and I think we truly considered that the first of the next generation discs. There's probably two aspects to the Mobi-C that I think are very, very positive for patients. Number one is you don't have to cut into the bone. Probably the other thing, and this is best seen on an x-ray, is the surface or the end plate of the Mobi-C actually contours and fits the human vertebrae more than a straight end plate or a straight surface that was really only available before that. I think in terms of the other absolutely transformational feature of the Mobi-C is that it's the first disc that's FDA approved for 2 levels. And clearly half the patients that we see in clinical practice and I see personally have 2-level problems. And for us to be able to treat 2 levels with motion appeals to patients, it appeals to us, and I think it raises the bar above what was available previously. When I sit down and counsel a patient, and now there are multiple studies, we've been studying artificial disc cervical 10 years in the US, longer outside the US, there is less of a chance of the need for further surgery in artificial disc patients compared to fusion. Most patients will say, if there's less of a chance of me needing surgery down the road, 5-10 years, the decision's fairly obvious, and most of my patients will choose disc replacement over fusion, assuming they're candidates for both. Today I saw my first Mobi-C patient that I did after FDA approval, and he came back for his 1-year checkup. His x-rays looked perfect, his motion was preserved, and he had no symptoms referable to his old arm or neck symptoms. And it's a repeated story. I almost exclusively use the product by choice. Some patients come in actually asking for the product specifically, and then many require 2 levels, and given the 2-level FDA approval, this is the obvious choice. And I think what I would tell patients is that if you have been diagnosed with a disc problem in your neck and told that you need to have a fusion, I think you really owe it to yourself to see if you're a candidate for artificial disc technology, and particularly for a 2-level problem for the Mobi-C.